Hello, my name is Tiago and I am a stroke specialist nurse at Mason and Tunbridge Wells NHS Trust. This video was created with the intention of providing you with information about stroke, your care on the ward and the existing support for both when you are an inpatient or after your discharge. A stroke is a medical condition in which poor blood supply to the brain results in cell death. It is a medical emergency and life-threatening. There are two types of strokes, ischemic and hemorrhagic. An ischemic stroke is the most common type. It's caused by a blood clot in the blood vessels, causing cut to the blood supply to a part of the brain. These can be due to different causes, but the main risk factors are atherosclerosis and atrial fibrillation. That is a condition that causes your heart rate to be irregular. An hemorrhagic stroke is a bleed in the brain caused by a burst blood vessel. This accounts for 10 to 20% of all strokes and has a higher mortality rate. The main causes are aging of the blood vessels together with high blood pressure. In terms of statistics, there are more than 100,000 strokes a year, one every 5 minutes, and it is the fourth leading cause of death. Average age for strokes in men is around 74, while in women is around 80. 1 in 4 stroke patients will have another stroke in 5 years. Nevertheless, there are 1.2 million stroke survivors. Common symptoms after a stroke include loss of power over one side of your body, loss of peripheral vision, speech impairment, loss of sensation, dizziness, incoordination, and difficulty swallowing. The recovery from a stroke normally involves a multidisciplinary team that includes doctors, nurses, therapists, including physiotherapists, occupational therapists, speech and language therapists, dietitians, and neuropsychologists, but also ward volunteers and external organizations such as the Stroke Association.
My name is Eleanor Doherty. I'm one of the senior specialist neurophysiotherapists here at Maidstone Stroke Unit. I'm part of a large and dedicated team of therapists who work closely together to provide a comprehensive assessment and rehabilitation service from the date of admission to discharge. One of the main roles of physiotherapy when you're admitted to the stroke unit is ensuring you receive a timely and comprehensive initial assessment. This enables us to work out how the stroke has affected you, and from this point we can start to provide a tailored rehabilitation programme. Our assessment looks at muscle power, tone, sensation, coordination, balance and functional ability. It is also crucial for us to communicate early with next of kin and family to establish functional ability prior to admission and background social history. All of this is essential to help us in creating a full picture of the person we are treating. As recommended by the National Institute for Healthcare Excellence, otherwise known as NICE, rehabilitation post-stroke starts early, from the acute care setting and continues all the way through to the home setting and long-term community support. Rehabilitation in the early stages will focus on many activities, for example, getting out of bed, transfers, standing and walking. Physiotherapy will focus on regaining function through regular therapy sessions, optimising movement and working on improving muscle strength and balance. We also aim to provide patients and families with advice on how to participate in your own rehabilitation, for example, doing tailored exercises with assistance from a family member, friend, or if able, to do some of these independently. We will also use various pieces of equipment during your therapy sessions, alongside skilled handling to promote recovery. In conjunction with other team members, we aim to work closely with families to aid education and understanding of the effects of stroke. We can, alongside conversation and discussion, provide written literature and information that the Stroke Association produce, and these leaflets are very helpful. These can all be accessed via the Stroke Association website. Following an inpatient stay, we often refer patients on for further rehabilitation to specialist units or to our colleagues who work in the community and can visit you in your own home. This is important as recovery from stroke can be slow and ongoing for many months after you leave hospital. If you have any questions, as a team and including myself, we are very happy to meet with you on the stroke unit at an arranged time, or if that is difficult, you can always call us. We have a dedicated answer machine number, which is 01622 224928, and if you leave a message, we will endeavour to get back to you as soon as possible. I hope to meet with many of you in the coming months on the ward, working together with you and your loved ones towards their recovery and the ultimate aim of leaving hospital and returning home. Many thanks.
Hello, my name's Jodie and I'm an occupational therapist here on the stroke unit at Maidstone. We know that strokes affect people in many different ways. Some people experiencing changes physically, cognitively or emotionally. It's my role as the occupational therapist to gather information of what the individual could do prior to their stroke and how the stroke has then affected them. Through standardised assessment, we will look at those individual areas, looking particularly at physical power and strength, coordination, sensation, visual changes, to those cognitive skills, to be orientated, to remember information, to be able to act on that information and maybe even concentrate on tasks. Through assessment, we will then be looking at bridging the gap in order to help that individual recover those skills that they've lost. We will do this with the individual and goal set and set short and longer term goals. Treatments might comprise from anything as simple as getting from lying to sitting in bed, to being able to move from one surface to another, so from bed to chair, through to purposeful tasks such as brushing their teeth, combing their hair, having a shower, to going on to other tasks of organising a meal, planning a route, and those things that we might need to return to work or our previous roles as a parent, a caregiver. At the point of discharge, the occupational therapist can offer advice and support of how to support your individual when returning home. So this may be actually looking at the environment and making recommendations for equipment or adaptation, through to taking the individual to the home for almost a trial experience to see how they manage at home. Once the individual is ready to leave the hospital, the OT and alongside the other members of the team will make recommendation for further referrals. So this may be for further rehab at home, to referrals to other charities that might support with financial advice, through to practical advice as well, such as the Kent Association for the Blind, who would give practical advice for people that have got visual changes, to the Stroke Association, who run many groups and clubs.
Hi, I'm Danielle. I'm a speech and language therapist here on the stroke unit. I'm going to speak about speech therapy role in terms of patients who have difficulties communicating and difficulties swallowing after stroke. So firstly, we would assess the patient to see if they have any difficulties communicating, whether that be with their speech clarity, so being able to move the muscles in their mouth to make their speech clear, or whether that is an apraxia of speech where they might have difficulties getting the message from the brain to the mouth to produce the words. Whether that's about their language, so whether they can understand when you speak to them, whether they can read, write, whether they can think of the words they want to say and make sentences. And then once we've assessed that patient, we will provide some strategies to help them to communicate better. And that's something that you as caregivers or family can also use to support the patient. And then we'll also provide some rehab exercises to help the patient to improve their communication skills. The other thing that we're heavily involved in with speech and language therapy is that we would support patients who do have communication difficulties to be part of their own decision making, so things that relate to their care. So whether that be whether they want to move somewhere else after they leave the hospital, if they want to go home, or whether they go to a different destination, or whether they have other certain types of medical treatment, the patient will need to understand the information that's they need to make that decision and be able to communicate it, so we can be involved in supporting and assessing someone's capacity for decision making. The other major role that we have on the stroke unit here is to assess patients who have difficulty swallowing. So a lot of patients after a stroke will have weakness in their mouth and their throat, and that can affect how food and drink moves down, and sometimes it can go towards the lung and cause chest infections and choking. So speech and language therapists will assess a patient to check if they are having difficulty swallowing and if they're at risk of having food and drink go the wrong way, which we call aspiration. And if that is the case, we will recommend strategies to try and prevent that happening, things like modifying diet and fluids or head postures. And then we will also again provide rehab exercises to try and improve the swallow ability. And the last thing really that we have an impact with is looking at longer term feeding decisions. So for patients who aren't able to meet all their nutritional requirements orally, we can support them to make decisions about longer term feeding, so things like a peg tube.
Hello, my name is Lauren and I'm one of the dietitians who works here on the stroke unit at Maidstone and Tunbridge Wells NHS Trust. Dietitians are registered healthcare professionals who support all stroke patients who are considered to be at high risk of malnutrition. We are able to assess the needs of any patient who's had a stroke based on many different factors. This would include their current weight and height, the type of stroke they may have had, their past medical history, and also any recent unintentional weight loss is taken into account. Dietitians are able to provide specialist advice that is tailored to the individual in order to prevent unwanted weight loss during their hospital admission. This would include recommendations such as high calorie, high protein snacks, meals and drinks, and individual ways to maximise the calories in the food that that person may eat. We will also assess the patient's nutritional intake and, if appropriate, offer them nutritional supplements such as these, Ensure products, if we feel that the individual isn't able to maintain their weight through diet alone during their hospital admission. We also provide specialist advice on how to change an individual's diet to prevent any further strokes in the future. And we work very closely with speech and language therapy to ensure that all of our recommendations are safe enough for an individual to swallow. If an individual is unable to eat and drink safely due to swallowing difficulties, dietitians create a tube feeding plan that will allow for the correct amount of nutrition and hydration, and we will continue to monitor that very closely. This can be through short term, which would include a nasogastric feeding tube, which is a tube that is passed through the nose and sits in the stomach, or longer term options such as a peg or a rig. These are tubes that are placed directly into the stomach to allow an individual to meet longer term nutrition and hydration needs.
On discharge, there are several services available to support you. These include care packages with different providers for different areas, Care Home Select for patients who are self-funding care at home or nursing home placements, early supportive discharge service and community neuro-rehabilitation team, health and housing and care navigator, stroke association, Kent Association for the Blind for those who experience visual loss after a stroke, Headway that helps brain injury survivors in their new circumstances reintegrate into their family and community life. In terms of secondary prevention, what can you do? Try to keep an healthy diet, reduce salt and processed foods, do regular exercise, comply with your medication, and reduce your alcohol intake.
Hello, my name is Rachel Bushnell. I'm a clinical lead occupational therapist with the Community Neuro Rehab team in West Kent. We have two bases, one in Sevenoaks and one in Coxheath, where I am now. And from there we serve patients with all sorts of neurological conditions across the West Kent area. One of those neurological conditions is stroke. So we see people who are going home from hospital after stroke to continue your rehab once you're home. Our team includes occupational therapists, physiotherapists, speech and language therapists, dietitians, and then we have our rehab assistants who support all of those professions, and we have our administrators who may be the first person you speak to if you phone our office. Our service for stroke patients includes STARS, which is what we call the Early Supported Discharge Scheme for stroke. So that's all part of what we offer as our team. So what can you expect from us when you go home from hospital? Well, normally the first thing that would happen for you is that you'd hear from our senior rehab support worker. They usually do that first visit when you come home. So the next working day after you go home from hospital, you would normally have a visit from a member of our team. That's Monday to Friday, so if you went home on a Friday you would see us on the Monday instead. And the purpose of that first visit is to check that you're settling home okay after your stay in hospital, that you've got all the right equipment and that's working for you, that if you're having carers coming in, that's all working out. So basically just to check that everything's going smoothly for you and you're settling back okay. That visit also identifies which of our therapists you need to see, so that you see all of the different therapists that you need to continue your rehab at home. We have links with the Stroke Association, so our rehab support worker might put you in touch with them after that first visit. They can also refer to neuropsychology. We work very closely with our neuropsychologists, but they're not actually based in the same team as us, and so that requires another referral. So that would be if you were having difficulty with mood, or your thinking had changed in some way after your stroke. So that referral can be done, and any other referrals that you might be needing from that visit. So things that our team doesn't cover but that you need, the referrals can be made after that visit. And then, depending on your needs, you would receive visits from the therapist that you need to see: a physiotherapist, occupational therapist, speech and language therapist, dietitian, and that would be within 2 weeks normally of your return home. We can't always manage that, but that's what we are aiming for, that you get to see every therapist that you need to see within those first 2 weeks. And then they will review your goals with you, things that you might have been working with already from hospital, and set new goals for you, what things that you want to achieve now that you're home. And they will advise you on what you can do for your own rehab. They may give you some exercises that you can be working on yourself every day, and that's really important. I can't emphasise that enough really, that what you do for yourself with your rehab is the thing that will help you to get better. What you do all day, every day, repeating, if you've got, say you've got a weakness in your hand and arm following your stroke and you're getting back some movement, the more times that you can practice using that hand and arm at home in your everyday tasks and doing the exercises you've been given, that's what helps you to get better. But of course you may well need us to visit you as well, so you may have 1 or 2 sessions a week perhaps from the different therapists that you need. That may be the therapists themselves, or it may be a rehab assistant following a programme set by the therapist. And typically you would have perhaps 6 weeks of receiving input like that from our team, from the rehab assistant, and then the therapist would review you, and they'll see how you're progressing with your goals, and see whether you need to continue with those, whether you're making progress and you just need to continue, or whether perhaps you need some more goals, that you've progressed and you need to move on. But also, if perhaps things are not getting much better, or you've completed your goals and there's nothing more for us to do, then you might be discharged from our team at that point. If you are discharged from our team, that doesn't have to be goodbye forever. If other needs arise, or perhaps you weren't making progress but then you start to make some more progress, you can go back to your GP and you can be re-referred to our team for another bout of rehab. But usually people have their rehab from us. That might be 6 weeks, that might be 12 weeks for instance, and then after that they're able to manage their own goals. They're perhaps back to doing the things that they wanted to be able to do, and they've sort of achieved their potential. So that's how we run our service, and hopefully that's helped you to know what to expect when you go home. And as a team we look forward to meeting you.
Hello and welcome to our Patient and Education Group presentation by the Stroke Association. I'm Jess Larkin.
And I'm Andy Sayers, and we're the support coordinators for West Kent.
We are here to help with rebuilding lives after stroke, because we believe everyone deserves to live the best life they can after stroke.
We provide specialist support, fund critical research and campaign to make sure people affected by stroke get the very best care and support to rebuild their lives.
Rebuilding Lives After Stroke is a team effort. It takes the determination of stroke survivors and carers, the generosity of supporters, and the dedication of the healthcare and research communities to get there.
The Stroke Association can support you in the following ways. Our support services include, but are not limited to, emotional and communication support, running stroke groups from choirs, art to peer support meetings, along with providing information on a range of subjects from returning to driving, dealing with fatigue, and benefit and financial support available.
By listening to and working with people affected by stroke, we drive improvements in stroke care through initiatives such as the FAST campaign developed with the Department of Health. We also have a great team of volunteers, one of whom you will meet soon. They play a vital role in the recovery of stroke survivors across the UK.
We can support you throughout your recovery with information in fact sheets, by phone, email, online, virtual and physical home visits. We also offer a review meeting 6 months after your stroke to see how you have progressed and what support you still feel you need. This is undertaken on behalf of NHS England and gets fed back to your GP.
Putting it simply, the Stroke Association is your safety net to make sure you have the information about the support and services that can help you. Let's hear from stroke survivor and stroke volunteer Andrew and his wife Jenny.
Hello, my name is Andrew and I had a stroke 11 and a half years ago. I had a very nasty headache and it was a week before Christmas 2008. I came into the house and I said to my wife Jenny that I've got a very, very bad headache. I need to sit down. So she said to me, well, why don't you go up and lie down on the bed? Which I did. And I remember shouting down to her about 15 minutes or so to saying that my headache is not going. And she came up to me and only to find me struggling to get to the toilet. And she whispered in my ear, I think you're having a stroke. So she then rang me the ambulance service, who arrived fairly quickly. I wasn't conscious at this, I'd already lost conscious. And I was taken into Maidstone Hospital. When they saw the CT scan when it came back, they saw that I'd had a very severe bleed and it was obvious that I would need surgery at King's Hospital in London. So that's what happened. I went to King's and I had a craniotomy, which is a surgery on my brain.
To drain the blood?
The worst thing that it's left me with, I think I can say, Jenny will confirm it or not, is that I've lost the peripheral vision on the left side of both eyes. So I'm not able to drive. I would say to anybody that's had a stroke, never give up. But be aware of you will get very tired for quite some time and depression might come in, but never give up because there is always hope at the end of the tunnel, and that's my message to both the patients and their carers.
So Jenny, as a wife and carer, how's it been for you?
Very difficult in the early days because it happened on the 20th of December. As you can imagine, we had our own business, which was wine trade, so just before Christmas was the busiest time. So I was going to work in the morning and then going up to King's in the afternoon. It wasn't until Christmas Eve that we realised that he was going to make it, because up until that time he'd got ventilators, tubes everywhere, couldn't speak, was unconscious most of the time. I knew he was paralysed because I kept pinching him, waiting for him to say ow, and he didn't. So, but Christmas Eve they took the tubes out and he spoke, and we knew, first thing he said was, "What's the cricket score?" So he knew he was going to be absolutely fine, although it would take time. Basically, he was away from home really for about 3 months. It was about March, April before we came home for good. And to begin with, I was wrapping him in cotton wool because his spatial awareness was all over the place. His cognitive thinking wasn't quite there. And you're anticipating all the time for them. Although he was all right mobility-wise, he'd walk into things and leave the cupboard doors open and then walk into them. And so you were anticipating the whole time. But after a few months as a carer, I had to step back and let him bump himself because I was a nervous wreck. You just had to sort of stand back a little bit and let them do things for themselves and make mistakes. As long as it was nothing dangerous, that they wouldn't really hurt themselves. You literally had to stand back. But no, it wasn't easy the first few 6 months, really.
Better.
It does get better. But you have to be patient and tolerant because they're not the same person. They are different in lots of little ways that most people wouldn't realise, but if you've lived with somebody a long time, you do notice it. So I found being tolerant at times is difficult, but I do try.
Thank you to Andrew and Jenny for their story and to show us how they have been rebuilding their life after stroke.
The Stroke Association are there for you, your family and carers to provide where we can
Emotional support including health and wellbeing advice, leaflets and publications through to signposting and referrals to other organisations as appropriate. We also have benefit and financial information to help support you during your recovery. We can also provide life after stroke and hardship grants.
Don't forget our support groups, which here in West Kent includes communication support, social groups, art therapy, choir and book club.
The Stroke Association is there for you, your family and carers. Sign up for our free online information portal where you can talk to other stroke survivors and their families at www.mystrokeguide.com. That is www.mystrokeguide.com.
If you're not online, don't worry. Our stroke helpline is available on 0303 3033 100, or you can contact both Andy and I directly on the numbers shown. We hope you have found this information useful, and please do contact us if you, your family or carers have any questions.
The Stroke Association.
Rebuilding lives after stroke.